Every 40 seconds, someone in the United States has a heart attack. That is roughly 2,000 people every single day. And here is the part that most people do not realize. The majority of those heart attacks did not come out of nowhere. The body sent warning signals, sometimes days in advance, sometimes weeks. But those signals were missed. They were dismissed as stress, as fatigue, as getting older. By the end of this video, you will know exactly what those warning signals look like, including the one that most people completely ignore, which happens to be sign number 3. And knowing this could genuinely save your life or the life of someone you love. Here is what this video will give you. First, you will understand what physically happens inside your coronary arteries in the minutes before a heart attack, explained in plain language. Second, you will learn the 5 specific warning signs your body sends before cardiac events and why each one occurs. Third, I will explain why sign number 3 is so commonly dismissed, particularly by women, and why that pattern has cost lives. Fourth, you will learn about a cardiac screening test that most people have never heard of, one that can detect arterial plaque years before symptoms appear. And fifth, I will give you 3 specific blood tests to discuss with your physician at your next appointment, tests that most routine checkups do not include. I am Dr. Sinclair. I am a physician who has spent years helping patients understand their cardiovascular health. My goal with this channel is to give you the same information I give my patients clearly and without unnecessary alarm. Let me walk you through what a heart attack actually is, because the term gets used so often that the mechanics become abstract. Your heart is a muscle. Like any muscle, it needs a constant supply of oxygen-rich blood to keep working. That blood reaches your heart muscle through coronary arteries, which wrap around the outside of your heart like small hoses. A heart attack occurs when one of those arteries becomes blocked, and blood flow to a section of heart muscle stops. Within minutes, the muscle cells that are not receiving oxygen begin to die. That is what a heart attack is. It is heart muscle death caused by interrupted blood supply. Think of it this way. Imagine a garden hose that waters a section of your lawn. If you pinch that hose closed, the grass downstream stops receiving water. At first, the grass is stressed. Then it starts to wilt. If the blockage continues, that section of lawn dies. The longer the blockage, the more damage. Your heart muscle works the same way. Time matters enormously. Now let me explain how that blockage forms in the first place, because heart attacks do not happen randomly. They are the result of a process that has been building, often for decades. The inside of your arteries is lined with a thin, delicate layer of cells called the endothelium. When the endothelium is healthy, it is smooth, and blood flows through easily. But certain factors damage this lining over time. High blood pressure creates physical stress on the artery walls, like water pounding through a pipe at too high a force. High blood sugar, particularly when chronically elevated, creates a kind of chemical irritation to the vessel lining. Smoking introduces toxins that directly injure the endothelium, and chronic inflammation, often from excess visceral fat, poor diet, or other metabolic conditions, creates an ongoing state of low-grade damage. When the endothelium is injured, your body tries to repair it. Cholesterol particles, specifically the small, dense LDL particles, can slip beneath the damaged lining. Your immune system sends white blood cells to clean up the cholesterol. Over time, this creates a buildup underneath the artery wall called plaque. The plaque is covered by a fibrous cap. Here is the part that changes everything. Not all plaques are equal. Some are stable, with thick caps. They narrow the artery, but often do not rupture. Others are what we call vulnerable plaques. They have thin caps, soft interiors, and they are prone to rupturing. When a vulnerable plaque ruptures, the contents spill into the bloodstream. Your body reacts by forming a blood clot at the rupture site, the same way it would form a clot over a cut on your skin. But inside a coronary artery, That clot can completely block blood flow within seconds. That is the moment of a heart attack, the plaque rupture, the clot formation, the complete obstruction. Now let me walk you through the 5 warning signs that often appear before this happens. Sign number 1 is chest discomfort. Notice I did not say chest pain. This is important. Most people imagine a heart attack as a sudden crushing pain in the center of the chest, and that can happen. But more often, the sensation is subtler. Patients describe it as pressure, tightness, or heaviness. Some say it feels like an elephant sitting on their chest. Others describe a squeezing sensation or a feeling of fullness. The reason this happens is that when blood flow to the heart muscle is reduced, even before it is fully blocked, the heart muscle becomes stressed. That stress triggers nerve signals that your brain interprets as discomfort in the chest area. The key distinction is that this discomfort often comes on with exertion and goes away with rest, at least in the early stages. This pattern is called angina, and it is your heart telling you that it is not getting enough blood during periods of increased demand. The mistake people make is assuming that because the discomfort goes away when they sit down, it was not serious. It was serious. It was a warning. Sign number 2 is pain that radiates to the arm, jaw, neck, or back. This one confuses people because they think, why would my heart cause pain in my jaw? The answer involves something called referred pain. Your heart does not have pain receptors in the way your skin does. When the heart muscle is in distress, it sends signals through the same nerve pathways that serve other parts of your body, particularly the left arm, the jaw, the neck, and the upper back. Your brain receives these signals but cannot always pinpoint the exact source, so it interprets the pain as coming from those other areas. This is why some people having a heart attack feel aching in their left arm and nothing in their chest. Others feel jaw pain that seems like a dental problem. Still others feel discomfort between their shoulder blades. When this type of pain occurs without an obvious cause, particularly if it comes with any other symptoms on this list, it warrants immediate attention. Sign number 3 is unusual fatigue. This is the one that most people ignore, and the reason this matters is that it is particularly common in women. Studies have shown that in the weeks before a heart attack, many people, especially women, report a profound, unusual tiredness that they cannot explain. Not the kind of tired you feel after a poor night of sleep. This is a bone-deep exhaustion that makes normal activities feel overwhelming. Simple tasks like climbing stairs, carrying groceries, or walking across a parking lot suddenly feel much harder than they should. The reason this occurs is straightforward. When the heart is not receiving adequate blood flow, its pumping efficiency drops. It cannot deliver as much oxygen-rich blood to the rest of your body. Your muscles, including the muscles you use for everyday movement, do not get the fuel they need. The result is fatigue. But most people do not connect fatigue to their heart. They attribute it to stress, to poor sleep, to aging, to being busy. Particularly in women, this symptom has been historically dismissed, both by patients themselves and sometimes by physicians. If you are experiencing unusual fatigue that does not improve with rest and has no clear explanation, it deserves evaluation. Do not assume it is just stress. Sign number 4 is shortness of breath, particularly at rest or with mild activity. This can occur with or without chest discomfort. When the heart is not pumping efficiently, blood can back up into the lungs. This creates a form of congestion that makes it harder to breathe. You might notice that you become winded walking short distances, or that you feel breathless lying flat, or that you wake up at night needing to catch your breath. Some people describe it as feeling like they cannot take a deep breath, or like they are breathing through a straw. The connection to the heart is often missed because people assume breathing problems mean lung problems, and sometimes they do. But unexplained shortness of breath, especially if it is new or worsening, can be the heart signaling that something is wrong. Sign number 5 is cold sweats, nausea, or lightheadedness without obvious cause. These symptoms occur because of your autonomic nervous system, the part of your nervous system that operates without your conscious control. When the heart is in distress, Your body activates what we call the sympathetic response. It is the same system that activates during a threat. Adrenaline and other stress hormones flood your body. Blood vessels constrict in certain areas. You may break into a cold, clammy sweat. You may feel nauseated as blood is diverted away from your digestive system. You may feel dizzy or lightheaded as blood pressure fluctuates. These symptoms often occur together, and they can occur without any chest discomfort at all. Some heart attacks, particularly in women, present with nausea, sweating, and fatigue, but no chest pain whatsoever. This is why they get mistaken for the flu, for anxiety, for food poisoning. If these symptoms appear suddenly, without an obvious explanation, and particularly if they occur alongside any of the other warning signs, they need to be taken seriously. Now let me address what damages your heart in the first place, because understanding this helps you understand why these warning signs appear. High blood sugar is one of the primary drivers of arterial damage. When blood sugar remains elevated over time, it damages the endothelium, promotes inflammation, and accelerates plaque formation. You do not need to be diabetic for this to affect you. Even blood sugar levels in the pre-diabetic range increase cardiovascular risk significantly. High blood pressure creates mechanical stress on your artery walls. Every time your heart beats, blood is pushed through your arteries with force. When that force is consistently too high, the artery walls sustain damage. They become stiffer, they become more prone to plaque buildup, and the heart has to work harder to pump against that resistance. Smoking is directly toxic to your blood vessels. The chemicals in cigarette smoke damage the endothelium, promote clotting, reduce oxygen delivery, and increase inflammation. Smoking remains one of the most modifiable risk factors for heart disease, which means it is one of the most controllable. Chronic inflammation plays a role that most people underestimate. Inflammation is your immune system's response to injury or infection. But when inflammation becomes chronic, when it persists at low levels for years, it damages your blood vessels from the inside. Sources of chronic inflammation include excess visceral fat, poor diet, chronic stress, and certain metabolic conditions. This is why some people with normal cholesterol still have heart attacks. Inflammation is often the missing piece. Here is what most people are not told. There is a screening test that can detect calcified plaque in your coronary arteries years before symptoms ever appear. It is called a coronary artery calcium score, often abbreviated as CAC. The test involves a CT scan of your heart without contrast dye that takes about 10 minutes. The radiation exposure is low, roughly equivalent to a mammogram. The cost is typically between $100 and $400, and many places offer it as a self-pay option. A score of 0 means no detectable calcified plaque. A score above 100 suggests moderate plaque buildup. A score above 400 indicates extensive plaque and significantly elevated risk. This test is not routinely offered. Most people have never heard of it. If you have risk factors for heart disease, ask your doctor whether a coronary calcium score is appropriate for you. If you are having symptoms that suggest a possible heart attack, call emergency services immediately. Do not drive yourself to the hospital. Do not wait to see if the symptoms pass. Time is heart muscle. Every minute of delayed treatment means more damage. While waiting for help, sit down or lie down in a comfortable position. If you are not allergic to aspirin and have not been told by a doctor to avoid it, chewing a regular aspirin can help thin the blood and may reduce the extent of clotting. Stay as calm as possible. If you are with someone who loses consciousness and stops breathing, begin CPR immediately and call emergency services first. Let me give you 3 tests to discuss with your physician at your next appointment. The first is hemoglobin A1C. This test measures your average blood sugar over the past 2 to 3 months. An A1C below 5.7% is considered normal. Between 5.7 and 6.4 is pre-diabetic range. Above 6.5 indicates diabetes. Many people are walking around with blood sugar in the pre-diabetic range without knowing it, and that elevated blood sugar is quietly damaging their arteries. The second test is high-sensitivity C-reactive protein, abbreviated HSCRP. This is a marker of inflammation in the body. A high HSCRP level suggests that your body is in a state of chronic inflammation, which increases cardiovascular risk independent of cholesterol levels. The third is the coronary artery calcium score. If you have a family history of heart disease or risk factors like high blood pressure or diabetes, ask your doctor whether this test makes sense for you. Heart disease is not a sudden misfortune that strikes at random. It is a process that builds over years, sends warning signals, and can be detected and managed. The 5 warning signs: chest discomfort, radiating pain, unusual fatigue, shortness of breath, and cold